I would really talk to you on a very basic level. It's a philosophical, but it's a truth also. Life is a journey. And illness is a very integral part with the present lifestyle. Then there is a restoration of health where the doctors and hospitals come into picture. And this conundrum continues. We keep falling sick. We keep getting well and then wait for another illness to come. But there is a journey further to that, which is wellness. Now, this component, we, the doctors and hospitals, can help you the least. This is, you can help yourself with what you call your positive active effort to change your lifestyle, keep things in order, because objective of any welfare state like India or anyone is not to treat complex diseases. Though myself and Dr. Ganpati happen to be in that arena of super specialization, but even our objective is how can we prevent diseases and promote good health. Now let us see, why do you want to see a doctor? The first thing is the anxiety. This is a case example I'll tell you. First thing, whenever you have a symptom or something, no disease, even to the doctors, come with a straight diagnosis. Most of the times it is something going on and you are scared of something and you want that anxiety to be settled. And the anxiety is without exception to every human being. And this anxiety need not wait in today's era for the next appointment of the doctor. If it happens to be a weekend or a COVID time, instantaneously you can get to the doctors. This is India, a country of Chandrayaan as well as bullock carts. This is a real life example. The gentleman is in a small village which I visit for 47 years. And every time I go, I have visited several times. Last time when I went about 4 or 5 years ago, I found this gentleman who was hemiplegic. Until that time, he did not know that cause of his paralysis and incapacitation is high blood pressure. I wonder and imagine and dream of a time when we would be able to remotely monitor the blood pressure of these people and control their blood pressures and not let them happen dependent on somebody else. This is a very common sight for us Indians. The hospitals are hub. I am taking it as a very positive part of it. This is our strong social system. I really don't want, because we are beyond the virtual world, a get well soon card. We really are with the people. But at the same time, we have to keep the social fabric, but make sure that the doctors and hospitals are able to do their work and the patient recover. The objective is not to show that I have come to see you, but to see the patient recover. I certainly don't like we have sat in these lifestyle OPDs for decades. How can a doctor concentrate on a patient? And if you try to see, I can guarantee 70% of them have just come to satisfy their anxiety. They need not have come. They will spend probably fraction of a minute with the doctor and take the prescription, which could have been easily done with telemedicine. Similarly, in this picture, you see it's very difficult to know who is the patient, and this happened. Dr. Ganpati would remember, having worked in government setups also, that many times we have to go and ask a question, who is the patient? Now, this is a situation, particularly in COVID and post-COVID era, is writing on the wall. We'll have to change our culture. How simple the telemedicine is. Most of us have cell phones, tablets in India, and there is nothing. Technology has become more simplified. It is convenient for the doctors. Doctor can talk to you, see what you have, get your all real-time latest parameters, compare it with the reports, even talk to the other doctors and give you an opinion which by no means would be inferior than you're physically showing in the hospital. Always, this is a myth when you talk, no, I have a very complex eye problem. It cannot be solved until I go. I concede to the point that it's not, we are not talking either or. We are not putting it as competitive modality. We are putting it as a complementary to the existing healthcare for your convenience and for the convenience of the rest of the world. So there are methods, very fine vitreoretinal regions, or dermatologists are able to see the skin very well with the kind of cameras we have, and there is no compromise in the diagnosis. A good telemedicine center would never tell you to come to hospital to reconfirm what he has. Yes, for interventional purposes or something to be done, he may need to do. This is yet another problem, and I'm sure of hundreds of you who are participating would relate with yourself in your family or friends. When we go to hospital, most of these lifestyle diseases, they come in clusters and patients have multidisciplinary involvement. It needs somebody to lift these patients from one appointment to the other. And I have yet to find a hospital which is so well coordinated that patients don't have to wait. Now, why it should be done in this era? This ordeal can be killed with a handheld where you can bring all the specialties, they'll have all your information, they can talk to each other and do a conference call within them, they can refer to the literature to advise you and give you a comprehensive thing. There is no question that cardiologists have written some treatment for hypertension which has been repeated or an investigation has been repeated by somebody else. So that is the magic of telemedicine at your stop. Another big role, if I see in India, I think straightway it has to go that after surgical period when you are convalescing or when you are really sick and you are discharged from the hospital, still you need a lot of care. You need to be followed up for a long period of time. And then you don't have to be taken to the hospital because, mind you, as I told you, for an Indian patient to be taken to the hospital, minimum 2 to 3 people, and 2 of them will have to take day-long leave from their work to make sure and a wishful thinking if they are able to achieve seeing all the doctors in the same day on the same appointments. So follow-ups can be done at your terms, and this really is highly recommended. Then comes, what is the ecosystem? Is critical care possible or not? Yes, we can bring the entire intensive care unit to your bedroom. All you need is that doctors are able to manage you from there with the trackers and sensors we have. All the parameters can be conveyed to them. Then this is a very collaborative kind of thing, international collaboration. And this is nothing theoretical. 20 years ago, this slide may have been a hypothetical situation, but consultants all the time talk to the people and colleagues outside, discuss the cases, and as a corollary to it, students learn about it. And the whole objective of medical science is to give best to their patients. And technology really would help you to bring best to patients. One question all of us post-COVID has taught us to ask a question when you think of stepping out of your house. For what? Even if you want to go and meet somebody, you'll think twice about it because it, besides the ill effects of lock-in, it has done so good to our environment. It has done so much good to the savings. Of course, the economy is on a back burner, but what I want to say is the hospital is no exception. You should always ask, and you should have always asked a question, why I am going to meet a doctor or this? Can I manage without going physically and taking my family to toll? Then the next question is, okay, if you need to decide to go to a doctor, or if you want to really have a teleconsultation, then you should know what do we expect from our doctors. This clarity no doctor can give. You have to rehearse, make your thing. First thing you expect is that your doctor should be able to listen to you. Understand, in my 5 decades long experience, if the doctors and my colleagues know one thing, they need not know high technology, they need not know the exact diagnosis of the patient at that point in time. If they know how to listen to his story, I can tell you for sure the diagnosis the patient tells you, if you are vigilant about it, satisfaction, 90% of the satisfaction is whatever may be the outcome of that meeting is that the doctor heard me every word. There would be a lot of trash. There would be a lot of redundancies. There would be a lot of unrelated issues. But that is what is the human psyche. I can tell you, your doctors would listen to you with telemedicine equally well or better than, because they would be better prepared with your information than asking for x-rays and asking for blood reports when you visit to them. Empathy again cannot be really it's a human trait. It cannot be linked to technology or not. Technology is often blamed for dehumanizing the thing, but it is not true. It is with things. You can comfort the patient even well on the teleconsultation. But we are not telling, as I told you, this is an example of a young very bright lady who had advanced colonic cancer at MIT. She's a very bright robotic um, faculty. At the age of 39, her life was devastated. But what she wrote after her recovery was that the hospitals reversed my belief that cancer is synonymous with death to true experience of hope. Now, mind you, hospitals are not monoliths. What she's meaning, the people working there. So it's a big challenge for the doctors and healthcare workers. Can we achieve this objective of getting that kind of certification even from a patient who is in a hopeless situation? Now, the trends globally are growing that 60% currently the healthcare has to be outside the hospital. Hospitals are not the places where we should encourage people to go. It's a myth that we want hospitals to be loaded because of the economic gains. No, because economic gain, if you see, the economics would be much more better for the hospital. Their infrastructure would be less utilized. Patients would be happy to pay more on telemedicine consultations and therapeutic interventions than this. And only when the patient really needs support, and even there are ceilings on critical care hospital stays. So I would like to say India has to have that trend of outpatient care. Of course, no compromise on the quality. Now, the future would look like that screen these patients. How Dr. Ganpati said that we want very few patients to go to the hospitals or no patients to go to hospitals. Yes, that is, I am a believer that will happen. You screen these patients, use technology and virtual clinics and home-based management before you let patient go for some intervention. And patients for more complex problems, those who work in US, would get admitted at 5 o'clock in the morning, and 3 o'clock they are ready to go home. We keep them in for 24 hours for insurance purposes, simply because most of the things, not that it is a hasty surgery, but most of the things are done before the patient comes for surgery, and we know everything about it. And then minimize hospital stay, which would need efficient processes, cutting edge technology, and excellent men care. Now, what would be the future hospitals? It's not, don't take them that the affluent countries have such facilities. Functionally, the future hospitals are like DuPont Children's Hospital with the ambience. These are not the places to lament, cry, or pain. They should be places of celebration. That is not my belief. That is belief of everybody. Look at this children's hospital. One child but interactive wall. He doesn't need a parent. He can really make sure that he's so comfortable with it and he will get any invasive procedure done. So the ambience of the hospital, this is a conceptual thing. Now, word over, pregnancy is not a disease. Delivery, why the delivery should be done in a hospital? It should be celebration. And that's why most of the obstetric care people have celebration lobbies, celebration centers, and most of the hospitals, modern hospitals have all lifestyle things and recreational facilities rather than the kind of hospital we have in mind. So now coming to the wireless technologies and tracking, which are the vital to telehealth systems, these are the numbers of patients in US, which is the target audience, and that's where the telemedicine helps in Alzheimer's or Parkinsonism disease, asthma, where the data is available. It is universally applicable, but most of the sleep orders, sleep lab can be run from home. Holters can be done more remotely. This is some of the benefits of telemedicine on literature, that in 3,000 patient study of home care monitoring, 44% admission drop. Daily 250 patients are efficiently monitored by 3 to 4 trained nurses, which brings in, if you compute, a cost saving of 10 million over 6 years. This is a huge opportunity cost in India if you try to do. Similarly, another study of Veterans Administration Hospital shows 25% reduction in hospital days and 19% reduction in number of hospital admissions. So what are the final benefits we are talking about? Hospitals and your infrastructure would be capacity utilization. The governments and policymakers would stop counting healthcare system with the number of beds. They would count with the number of functioning beds. And then productivity will go up. Cost of care will bound to come down. Once cost of care comes down, it is for the whole system, including the patient, quality will go up and there would be no duplications and redundancy. Some of the examples, sense for baby, particularly for high risk pregnancies, you don't have to put a parturient mother in hospital for any exigency. These ladies can be managed very effectively at home by fetal and maternal mortality. And similarly, this is what it happens, that obstetricians are able to manage them with imaging, fetal and maternal signs, and give an alarm as and when they need to be moved to the hospital. Rehabilitation, major thing. We have been practicing in MediCounsel. There are tools where if somebody has a neck pain or a shoulder pain, there is no need for you to take appointment with physiotherapy. We can really deal with it online and make sure that you do the exercises correctly, bringing in the experts, and your recording can be seen, and exactly the next set of exercises which you need can be given. Please try these tools. They are not cynical. They may not be available routinely, but this is a demand-driven market. When you will ask for it, hospitals know that they will be able to get them. Leaving with your final thought, that like we have the exigency for power outage at homes, like we have torches ready, candles ready. Please mark my words. Equip your homes with telemedicine gadgets. They are not expensive. They need not be. I'm talking of preparing your patient, and in your family, you should familiarize yourself with the video conferencing. You should familiarize yourself with the digital weighing machine, digital blood pressure equipment, ECGs. All you need to do, any intelligent person can give this information to the doctors, and doctor would be able to make a decision. Thank you very much for your patient listening.